Semiliki responds to these huge challenges in DRC by supporting a network of highly motivated and capable Congolese people who provide solutions. Semiliki has been a reliable partner to health coordinators and social entrepreneurs for a decade. The small but regular money we provide enables these people to supervise projects that transform lives. The medical work we support includes over 50 health centres and hospitals. These are spread out along the 1,300-kilometre stretch of land forming the northeast corner of DRC, bordering neighbouring Tanzania, Burundi, Rwanda, Uganda and South Sudan. This includes many of Africa's Great Lakes. It is one of the most densely populated parts of the country, with these health facilities providing health services for 1 million people. The centres are run by the Anglican Church of Congo and are all part of the official Congolese Government Health Service, although receiving almost no help from the state. Semiliki built the operating theatre at St Matthew Hospital in the heart of Bukavu, a bustling city of 2 million people that still lacks the most basic amenities and city planning. St Matthew serves the poorest neighbourhoods and charges much less than other hospitals in town. Semiliki has supported the hospital from the outset, including the original consultation block and maternity. Fundraising campaigns have also equipped the operating theatre in St Matthew and 3 other hospitals. Equipment is purchased from specialist agency Medical Aid International, who send robust equipment adapted for challenging settings and who have generously added many other items of kit to the order. The impact of these operating theatres is enormous, as they save the lives of many women by offering safe operative delivery and surgery when needed for complications. After the kit arrived to newly opened Bukaringi Operating Theatre, the team carried out 11 C-sections in the first week. Dr. George is increasingly taking on more specialist surgery, including orthopaedics and paediatric surgery. Recently, Dr. Christina has done surgical safaris to Mahagi and Aru to repair women with obstetrical fistulas. As well as health facilities, Semiliki supports projects for orphans and women who have been victims of violence. These projects both provide care and training, restoring hope and dignity. The Compassion Orphanage in Butembo looks after 60 children whose families were killed in some of the extreme violence that has raked pockets of eastern DRC over the past 2 decades. Semiliki, working with partners, the Congo Church Association and St Andrew's Church Oxford, is building the second of 4 family homes for the orphans, and is also supporting initiatives to speed up family reunification and safe adoption. Semiliki's regular support of the orphanage helps pay for food and medical expenses of the children and to give small incentives to the volunteers. Semiliki coordinates its support with 3 other agencies. In Goma, the Tumaini School provides free education for orphan children who stay with host families. Development projects, supported by Semiliki, help poor families have a goat or pig that provides an asset to help lift them out of poverty and has transformed the livelihoods of many families in the Kalehe area near Lake Kivu. Semiliki supports 7 medical coordination teams to equip and supervise the network hospitals and health centres. Donations to Semiliki are used in myriad ways by the coordinators to buy equipment and drugs, lab reagents, beds and mattresses, laptops and printers, motorbikes, spare parts for vehicles, and to pay transport costs, provide some staff incentives and training, and helps pay some of the administrative costs faced by the health facilities. Money is sent to contribute to building costs, including building 2 teaching blocks for the Aru Nursing College and Library, iron roofing sheets for consultation blocks, and half the cost of new maternities at Kirunga, Kasihi, and Ijwi Island, at Ikanga and Rumu. Bukaringi Hospital has built accommodation to house a doctor and bought a new motorbike with Semiliki support. Semiliki is supporting mental health services provided by psychiatrist Dr. Amani. Semiliki also provides grants for students studying nursing and medicine. Dr. George recently completed his 5-year surgical specialisation with a high distinction. Uweki and Lupayi are studying medicine. Janine is studying accountancy. Serge is about to start specialising in anaesthesia. Semiliki Trust has no costs or overheads in the UK, so all money goes to Congo and is spent on these projects, minus small bank charges. All the trust roles and jobs are undertaken voluntarily by the advisors, treasurer, trustees, administrator and web-based designer. Semiliki does not run any projects, but provides seed money to the project coordinators in DRC. All projects have to provide detailed accounting, including scans of all purchased items and receipts. Despite working in one of the most extreme environments, Semiliki has over the past decade been able to account for all money that has been sent. The small but regular amounts that Semiliki sends and the advice provided has a transformatory impact for people in Congo, helping to develop hospitals and health centres, a nursing college and an orphanage.